Thanks for joining us for Season 6 of the ACED podcast. ACED is brought to you via the Justice Community Opioid Innovation Network, or JCOIN, with funding from the National Institute on Drug Abuse. I'm Danielle Rudes, your host, coming to you from Sam Houston State University in Texas and bringing you amazing science from today's top scholars and researchers in easy-to-understand language. The theme of Season 6 is diversity, equity, and inclusivity within the justice and health research field. I can't wait to share this season with you. Thanks for listening. Now, let's get started. In this episode, we'll spend some time talking about opioid use disorder in relation to people during and after pregnancy. Opioid use disorder is a chronic disease and can show up at any point in someone's life. As time goes on, challenges in the form of substance use disorders are becoming even more prevalent in people who identify as women. Women's deaths related to drug and alcohol use have been rising at a rate faster than men. Substance use has become one of the leading causes of pregnancy-associated morbidity and mortality in the United States. There is also growing disparity in the opioid use disorder outcomes by race and ethnicity. There are now more Black individuals dying from opioid overdose than white individuals. These racial disparities are also true for individuals experiencing pregnancy and postpartum. In Virginia, specifically, there has been an over 100% increase in overdose deaths in the last 7 years. Since there is such a high prevalence of substance use disorder among those who are uninsured or have Medicaid, in 2017, the Virginia Department of Medical Assistance, or DMAS, created a Medicaid benefit package that covers the full care of substance use disorders, including increasing access to MOUD. MOUD, or medications for opioid use disorder, is known to reduce the risk of overdose and improve health outcomes. This package in Virginia is known as the Addiction and Recovery Treatment Services, or ARTS. Early evaluations of ARTS suggest it has positive impacts on increasing access to MOUD and improving health outcomes. There are 3 medications for OUD that are included in MOUD: methadone, buprenorphine, and naltrexone. When DMAS created ARTS, one of the high priority populations they identified in need was pregnant and parenting people. This is because they have unique challenges in substance use disorder treatment. It is crucial to find state-level information on pregnant and postpartum people because of their unique challenges to help guide timely public health interventions. One study by Caitlin Martin from the Department of Obstetrics and Gynecology at Virginia Commonwealth University and her colleagues examines this topic. This research team wanted to report on the prevalence of OUD-related hospital use during the postpartum period and assess how prenatal treatment for OUD is associated with postpartum OUD-related hospital use. Now, by hospital use, I mean overdose events, emergency department visits, and acute inpatient stays. The researchers also looked at any racial differences between white and Black individuals. To examine these topics, they had to get data from somewhere. In this case, they used Virginia Medicaid claims and enrollment data from Virginia DMAS for people who delivered a child between July of 2016 and June of 2019. To see any diagnosed conditions, treatment, or services used, they used paid claims data. When one person delivered more than one child between 2016 and 2019, they were treated as totally separate events in the study. The researchers were looking at people using Medicaid, but they only included those who delivered a child when they were covered by full Medicaid benefits, not emergency Medicaid. In total, this study had an enormous sample size of 96,649 people. So, what did the researchers use as variables for this study? Well, the main outcome or dependent variable was postpartum OUD-related hospital use in the 12 months after child delivery. The predictors or independent variables for this study included quite a few things, such as sociodemographics, diagnosis of an OUD in the 12 months before delivery, preterm birth, and so much more. The researchers also did another analysis of just the people who gave birth who had an OUD in the 12 months before they delivered. This included 2,456 people. When looking at the primary aim of their study, the researchers used descriptive analysis to estimate the rates of opioid use disorder-related hospital use across the postpartum period. They divided the postpartum period into 4 time periods over 12 months. To examine the secondary aim of their study, the researchers used a logistic regression. This is a form of analysis that looks for relationships between 2 variables, but what makes it different is the fact that it only is used when the outcome variable is what's called dichotomous. Basically means it has 2 options like yes or no. Lastly, the researchers separated their analyses by race to look at racial differences. Just to make sure their results were accurate, the researchers also included what's called a sensitivity analysis. Sensitivity analysis is a way of digging down a little bit more into preliminary findings to determine how different values of an independent variable affect a particular dependent variable under, a given set of assumptions. What these researchers found was both super interesting and exceptionally critical. In the primary analysis, the researchers saw that postpartum OUD-related hospital use occurred in 0.6% of all deliveries. Yes, that's less than 1% overall. For people who had OUD during pregnancy, 10.7% of them had postpartum OUD-related hospital use. This was even more common for Black individuals. Interestingly, postpartum OUD-related hospital use was over twice as high for people who received MOUD during pregnancy. When looking at race, Black individuals had lower odds of postpartum OUD-related hospital use. On the other hand, though, Black individuals who had an OUD diagnosis had 11 times higher odds of postpartum OUD hospital use. This was much higher than the odds for white individuals. For people who are parenting, the postpartum period of their life course is incredibly important for ensuring their health and wellness. When people have an OUD, this can be a very vulnerable time for them. OUDs are a serious issue for pregnant and parenting people in a time when there is an overdose crisis, well, really any time. This crisis is even more prevalent among Black parents who had more overdose events and OUD-related hospital visits in their postpartum period. The findings here highlight the need in our society for opioid, substance use disorder, and other behavioral health conditions to be included in public health approaches that are working to end health inequalities for pregnant and postpartum people. People who are in the postpartum period are at a significant risk for substance-related death. We need to answer the call to implement evidence-based practices in the screening and treatment of substance use disorder and specifically opioid use disorder to help lower that risk. This can be difficult, though, because the perinatal care systems do not function in a way that facilitates that change. As the American College of Obstetricians and Gynecologists postpartum care guidelines suggest, we need to tailor postpartum care to the individual needs of each patient. Each pregnant or postpartum patient is their own person who has their own needs. These critical points need to be remembered in practice. It is imperative that the health field redesign postpartum care for individuals with opioid use disorder to include support and personalized approaches all the way through the first year after delivery. Pregnant people are severely underdiagnosed with substance use disorders, and this may be because they are afraid of discrimination and punitive child welfare reporting policies. These barriers do not just prevent diagnosis, though. They prevent pregnant people from getting the treatment they need for themselves and for their growing families. This can be even worse for Black individuals because of systemic and structural racism. Systems that use non-judgmental, evidence-based substance use screening and treatment that is tailored for birthing individuals, specifically those within historically marginalized groups, need to be promoted to help get rid of racial disparities. The researchers in the study make a profound call to action that we will echo here. Make bold and decisive actions to get rid of barriers to long-term MOUD treatment, substance use stigma, and the systemic and structural racism faced by pregnant and postpartum people. Do it for them. Do it for all of us. Thanks for tuning in to Aced It, where we translate science into sense. You can find Aced It anywhere you listen to podcasts and check out our other offerings on JTech. That's www.jcoinctc.org/JTech. That's JTEC. We consider it our mission to help everyone learn. On JTech, you'll find e-learning courses, webinars, and other trainings, all geared to help you learn about justice and health research and research methods quickly and easily. Special shout out here to George Mason University, home of the Coordination and Translation Center for JCoin, Sam Houston State University, and National Institute on Drug Abuse and the National Institute of Health. Also, if you'd like us to break down some research that you've read or produced in a future episode of the podcast, send it to me at drudes, RUDES, @shsu.edu. See you next time on Aced It.